Hi, counselors. Welcome back to LeeBella Coaching and Counseling. I'm Scott Spiers, a licensed clinical addiction specialist in North Carolina, and also providing services in the great state of Illinois. So, today we are covering Core Function VII, which is case management. And this is probably going to be one of the shorter videos that I've done. It looks on the surface like this core function is self explanatory, and in terms of the exam, it probably is. So I'll go over the exam material. Hang with me though, because I'm going to have some practical observations based on my experience and how case management is actually one of the most involved and important core functions in all of addiction treatment. So, first, what is Core Function 7 case management? It is activities which bring services, agencies, resources, or people together within a planned framework of action for the achievement of established goals. And in case you missed it, that's kind of referring to the treatment plan. It may also involve liaison activities and collateral contacts. The global criteria on this, thankfully, in terms of memorizing, there's only two. One, coordinate services for client care, and, as usual, explain the rationale of case management activities to the client. Wait, what? Activities is an incredibly broad term. In a practical sense, those activities are going to include these and many other, which I won't be able to list here. Google searches. Your ability to search and research using Google is instrumental in order to carry out case management. On top of that, you're going to have professional contacts, the people that you've met over the course of your schooling, your internship, and your career. You want to have a list of them so that they can help you with the case management. Another little appreciated aspect of case management is understanding your own facility's policy and procedure. But in one way or the other, you're also going to need to know and understand the policies and procedures from all stakeholders. And in case you didn't know, a stakeholder is a term for all the different organizations and people who are working together in client care for your particular client. You're also going to need to coordinate multiple schedules. Now, as part of case management, a lot of people in the field were working with people without viable means, minimal employment, cultural issues, poverty. So, as part of case management, you can be trying to find housing, you might be trying to find medical services, and dental care is a big one in a lot of areas. Uh, Transportation. Some Medicaid providers actually can arrange transportation back and forth for appointments, so that's part of case management. You might also have to find mental health services. You might have to assist them with food, clothing, daycare, almost anything that you can imagine. This core function can and will burn you out if you don't know what to do. And also, liaison activities and collateral contacts. Liaison is actually one of the coolest things that you can do as a counselor. I've been able to be on anti gang units when I was working in Salinas, California. Um, you can be in workshops with hospitals, liaison. Also, if you're in criminal justice counseling, that's working directly with probation and parole. You might have aftercare units that you're doing liaison with. So liaison is really cool. And finally, collateral contacts. Collateral contacts means getting additional information from family members, teachers, employers, and again, the aforementioned Department of Social Services, probation, parole, etc. These are all within the realm of Core Function 7 case management. I remember I was about 2 to 3 years in my career, and I talked to my favorite clinical supervisor. His name was Kent. I asked him once, what's the difference? What turns a good counselor into a great counselor? And his answer to me, laughingly, was case management. The second one was report and record keeping, but we'll get to that a little bit later. And I just kind of laughed that off for a while. And then I became a program director for a methadone clinic. And I have this guy, his name is Kevin. He's now a clinical supervisor in his own right. He performed what I consider genius level case management. You see, the company decided that we were going to take Medicaid and Medicare. Um, Traditionally, 5, 6 years ago, methadone clinics didn't, but we got the green light and we went ahead and did Medicare. And none of the senior executives, and including the PhD who was running the whole thing, they didn't have a clue how intricate and how involved Medicare and Medicaid can be. So, like every other methadone clinic in the country, we had room for 11 counselors. We only had six. We had like 50 or 60 treatment plans that were expired at any given time. And Kevin drove me crazy. Seriously, I had a full head of hair until I met Kevin. He would drive me crazy. It could be like, I'd be, Kevin, where are we at on these 13 treatment plans we need updated? And he'd say, I don't know, boss, let me get to you in a minute. I'm talking to Medicare. So actually, it was Medicaid at the time, and Medicaid is run by the states. It has federal guidelines, but each state has their own guidelines. And then every single county, depending on the state, they might have their own licensed Medicaid entity or MCO, managed care organization. They're the ones that have the rules, the policy, the procedures, how to submit billing, how to submit treatment plans, how often do they need. It's really really complicated, and we had no idea what we were doing. So Kevin spent hours, day after day after day, talking to the individual LMEs that we worked with. And where we were at, we were within shouting distance of, I think it was three different LMEs that were dispensing the funds, and each one of them had different policy and procedure. And it drove me nuts because we needed to get the treatment plans done, but he was totally right. He learned every single person that he needed to contact on every single issue with the Medicaid. He got so good that the senior executives were calling him for guidance on how to figure out how to manage our Medicaid clients. And I swear to God, it's true. The LMEs, MCOs would actually use him as a resource in consulting with other LME, MCOs, and in some cases clarifying their own policy and procedure. And that wasn't enough. If you're a methadone patient, you're supposed to be dosed every day at a certain level. You have a prescription. Well, sometimes people have to go to the hospital for surgery, emergencies, etc. And anybody out there who's coordinated with a hospital on getting their dosing record knows how impossible this could be because they've been technically absent from the clinic, let's say for 3 days. We have to be able to document that they received the correct level of methadone, or we have to dose them at a lower dose and build them back up. The hospitals, at least where we were at, were notorious for never providing us with that information. Kevin refused to let go of it. He learned every single nurse, every single dosing nurse, all the doctors, all the way up to the directors who were running the hospital. And he had a binder of what hospital it was in. He'd just open it up, make a phone call, and take care of it. This dude took case management to the max, but it took weeks for him to compile this information. Because of the work he did, I personally believe he saved more lives and improved quality of life for more patients than any single counseling theory, counseling technique, or treatment plan. Conversely, I have another supervisee who that is her job is case management until she becomes fully licensed. And like almost every other treatment facility I've heard of, they just threw her into the thing without training. So, because of what Kevin taught me on case management, I'm actually able to work with her directly and point out. You need to fine tune your Google skills. You need to write in exactly what it is you're looking for, contact the facilities, arrange coordination of services, and the whole nine yards. So, thanks to Kevin and all the lessons that I learned, I can actually provide uh, practical clinical supervision within the core function of case management. So if you're lucky, you're going to have a case manager at your own facility. And I'm willing to bet that they are the most overwhelmed and overworked employees in your facility. It's not an easy job. And the only degree, master's level or bachelor's, that I'm aware of that even begins to cover case management is social work. So, my advice to you, the budding counselor, is pay attention to case management. It is one of the 12 core functions. You might find that you're spending 20, 30% of your day actually doing case management activities. So, here's a few strategies for you to build up your case management skills. Suggestion number one is instead of taking your continuing education units, your education requirements for relicensure, don't take all of them online. Try to go to one or two a year where you're actually meeting people. You would be amazed the kind of resources that you can meet when you're physically in a room with somebody. I remember one of the best case management situations I ended up in. I got certified to do DWI services here where I live. I met three people that 3 years later I'm still in contact and I can still do case management. So, whenever you can, go to an actual class. You'll be amazed how many people you can meet. Two, develop a network. When you meet people, at least in my day, it was exchanging business cards. I'm not sure what you crazy kids do now, but get their name, get their phone number, what kind of facility they're at. Again, nothing is more valuable to case management duties than having a strong network. Finally, keep a binder so that you have all these different resources at your fingertips. Our patients sometimes need a lot of help and they need a lot of case management activities. It is one of the core functions and it is expected that you know how to do it. So meet as many people in real life as you can, keep track of who they are, and develop those strong relationships because this core function will either burn you out or it'll elevate you. So keeping that in mind, you're probably going to have less burnout, less frustration. Oh, and nothing improves therapeutic bond quicker than effective case management. When a client has an issue they need resolved, they need to find resources. If you can just go, here's the phone number, pick up the phone while they're in your office, arrange it. Oh man, that's a bond that is probably never going to go away. So that's it for case management. There isn't a lot to memorize. There's only two core functions, and that's about it for this core function. So if you have any questions, let me know in the comments. In the meantime, I'll have my Psychology Today profile down below if you want to contact me for career coaching, for exam coaching prep, or if you're in Illinois and North Carolina, if you need counseling services yourself. Until next time with Core Function 8, this is Scott from LeeBella Coaching and Counseling saying thanks for tuning in. I'll see you next time.